Good morning. This is Dr. Amitha from the Department of Oral and Maxillofacial Pathology. Today we'll be talking about periapical granuloma. Chronic apical periodontitis or periapical granuloma is a low-grade infection which is characterized by a localized mass of chronic granulation tissue formed in response to the infection at the apex of the root of a non-vital tooth. It is an asymptomatic sequelae of acute apical periodontitis and is characterized radiographically by periapical radiolucent changes and histologically by the lesion dominated with macrophages, lymphocytes, and plasma cells. The term periapical granuloma is a misnomer because the lesion is chronic inflammatory in composition and not a tumor. The term granuloma denotes granulomatous tissue, that is, granulation tissue and chronic inflammatory cells infiltration in a fibrous connective tissue stroma. What is the cause of this lesion? The lesion is caused by the death of the pulp, followed by a mild infection or irritation of the periapical tissue that stimulates the productive cellular reaction, resulting in the formation of a periapical granuloma. The clinical features associated with this are the teeth associated with periapical granuloma is non-vital. The patient may experience a slight tenderness on percussion. Percussion produces a dull sound because of the presence of granulation tissue at the apex of the root. Patient may also complain of mild pain on biting or chewing on solid food. The patient may have sensitivity due to hyperemia, edema, and inflammation of the apical periodontal ligament. In some cases, the patient may feel as if the tooth is slightly elongated in the socket. Many of the cases are actually asymptomatic unless the lesion has undergone an acute exacerbation. The radiographic features associated with this lesion is, at the earlier stage, there is a thickening of the periodontal ligament at the root apex. This is followed on later on by the formation of a well-circumscribed radiolucency attached to the apex of the root, along with a radio-opaque sclerotic border, which indicates that the periapical lesion is a slowly progressive and long-standing lesion. Coming to the histological features, the periapical granuloma consists of inflamed granulation tissue surrounded by a fibrous connective tissue wall. The granulation tissue demonstrates a variably dense lymphocytic infiltrate that is intermixed with neutrophils, plasma cells, histiocytes, and less frequently the mast cells and eosinophils. When numerous such plasma cells are present, scattered eosinophilic globules of gamma globulin, called as the Russell's bodies, are seen, along with clusters of lightly basophilic particles called as the pyronin bodies. In some granulomas, large numbers of phagocytes with ingested lipid material is seen in groups forming sheets called as the form cells. Abundant mast cells may also be seen. There may be deposits of cholesterol and hemosiderin in some granulomas, which was derived from the breakdown of extravasated RBCs. Cholesterol crystals may be seen as clear needle-like spaces or clefts due to the dissolving of the contained cholesterol by the agents which were used in the histological tissue preparation. and this is associated with multinucleated foreign body giant cells. Another important feature is the presence of epithelium, which has been derived from the epithelial rest of molasses. The epithelium of the periapical granuloma may also originate from the respiratory epithelium of the maxillary sinus in cases where the periapical lesion has perforated the sinus wall, or from the oral epithelium growing in through a fistulous tract, or from the oral epithelium proliferating apically from a periodontal pocket or bifurcation or trifurcation involvement by periodontal disease, along with apical proliferation. An occasional finding in some granulomas is the presence of a pulse granuloma, which consists of inflammatory cell infiltration, collections of foreign body type giant cells, and the presence of ring-like structures called as Rushton bodies. The Rushton bodies are composed of an eosinophilic material resembling the hyalinized collagen, sometimes may be seen as fragments of foreign material, and sometimes resembling a vegetable matter such as legumes, hence the term pulse granuloma. Pulse granuloma has also been reported in granulomas in edentulous jaws, nasopalatine duct cyst, and chronic periostitis. So here you can see the collections of the inflammatory cells, foreign body type giant cells, and the presence of ring-like structures called as the Rushton bodies. The Rushton bodies, which are composed of an eosinophilic material resembling the hyalinized collagen. The peripheral bone is usually lined by osteoclast with few areas of bone resorption. Sometimes the root surface may show external root resorption due to cementoclastic activity or hypercementosis due to cementoblastic activity. The microbial organisms associated with this lesion are the Streptococcus viridans, Streptococcus hemolyticus, non-hemolytic streptococci, Staphylococcus aureus, Staphylococcus albus, Escherichia coli, and pneumococci. So how do you diagnose a periapical granuloma? The involved tooth is usually non-vital and may be slightly tender on percussion. The percussion, as pointed before, may produce a dull sound instead of a normal metallic sound because of the presence of granulation tissue around the root apex. Radiographically, the thickening of the periodontal ligament seen at the root apex with a lack of continuity of lamina dura is seen in the initial stages of the lesion. As the proliferation of the granulation tissue and concomitant resorption of the bone continues, the periapical granuloma appears as a radiolucent area of variable size, seemingly demarcated from the surrounding bone. Sometimes a thin radiopaque line or zone of sclerotic bone is seen outlining the lesion, which indicates that the periapical lesion is a slowly progressive lesion which has probably not undergone any acute exacerbations. On vitality test, a negative response is obtained. Coming to the treatment part, the tooth can be treated by an extraction or root canal therapy with or without subsequent apicectomy. Apicectomy is a removal of the tip of the root of the teeth, which is known as the apex. If this lesion is untreated, the periapical granuloma can get transformed into an apical periodontal cyst. An apical periodontal cyst. These are the reference. Thank you.